You're recording?
Yep, all good.
Okay. Well, welcome everyone. Thank you so much for coming along tonight. It's actually my privilege to introduce our speaker tonight, and I'm very proud to introduce Associate Professor Darren Morton. But I'm a primary teacher, so I need to have a little mini quiz first. I promise it's only one question. So a single trivia quiz. Does anyone know what the acronym ETAP stands for? I'll give you a hint. It's a medical condition. And if you think you know it, I'd love you just to unmute yourself and tell me what the answer is. ETAP. Anyone know?
I know.
You be quiet. You're not allowed to answer. Well,
all right.
Is it the runner's stitch? Was that what it was? I heard that somewhere, read it.
Is that you, Bryce?
Yes.
That's very, very, very clever. I'm impressed.
Well, thank you.
I've only learnt what it is today.
I don't know what it means. It's just...
It stands for exercise-related transient abdominal pain, more commonly known, as Bryce has just told us, as the stitch. But what you may not know is that our speaker tonight happens to be the world expert on ETAP. So there you go. Although these days he's changed his focus quite a bit and is an absolutely ardent and highly respected leader in the field of lifestyle medicine, who loves nothing more than helping people to flourish and to live their best lives. Mind you, for those taking the exercises medicine unit this semester, you know where to go for help if you start suffering with a stitch while you do some exercise later on in the unit. So that's where you need to go. Go to the world expert. I can also tell you that I know Darren to be very influential and persuasive. The reason I know this...
That sounds bad.
I know this is because in October last year, I somehow found myself in a very unexpected place, hanging underneath a huge oversized kite, soaring high above Orlando in Florida. And I must admit, it's very influential, but I absolutely love that experience. He's also very influential in the lifestyle medicine space as a researcher and educator. And in fact, he's just one of 4 people worldwide who was selected to write the board certification exam for the International Board of Lifestyle Medicine. And he's also presented, as many of you probably know, many times internationally, as well as home in Australia. Actually, as a side note, I want to give you a word of advice. Never ever sit in a seminar room next door to where Darren is presenting at a conference, because you'll end up green with envy, because you'll listen to people laughing hysterically, raucously singing crazy songs, and you hear it all through the paper-thin room divider while you're there trying to stay focused on your very serious speaker in front of you. It's absolutely miserable. Actually, Darren's also the author of numerous books and over 60 publications in scientific and medical journals, which I'm very jealous of. That's an amazing feat. He's a key presenter in the Complete Health Improvement, or CHIP program, and as many of you know, has recently created and presented an exciting wellbeing program called the Live More or Lift Project, and has spearheaded the development of the lifestyle medicine degrees here at Avondale that many of you are now part of. If you've met Darren already, you'll know he's practically full of jumping beans and has a contagious zest for life. He gets excited about many things: hang gliding, kite surfing, running, riding. He's also especially passionate about his family, his beautiful wife Sarah, and their children Olivia, Lige, and Caleb. And one last word of advice before he gets started. It doesn't matter if you're 21, the fittest you've ever been, in the prime of your life, or championing your state at running middle distance. Don't challenge him to a race unless you are happy to have a slice of humble pie, because he doesn't only walk the talk, he runs it everywhere. Welcome, Darren. We look forward to what you have to share with us tonight.
Thanks, Mel. Oh, I think we can just wrap it up now because it might be all downhill from here. Actually, I heard someone, they were about to present one time, and they get up and someone read out a really nice, little introduction. And then the person says, Well, you know what? That was lovely. That was so inspiring. I can hardly wait to hear what I'm about to say. But hey, Mel, no, thanks so much for that introduction. And yeah, I think probably I know many of you, and I'm looking forward to getting to know those who are new to the course more as we go through. Mel's, is now the course coordinator for the Lifestyle Medicine postgraduate courses here. I get to be involved, but yeah, she's done an amazing job in just taking it to the next level. So it's really cool to have her part of it. And you guys are lucky to have her as the course coordinator. I'm going to share my screen with you, if that's all right. And we'll see if this comes up okay. Ta-da! Can you see that? All good. Okay. All right. Well, we're going to talk about a topic that I love, and it's called, I've called this Exercise as Medicine, a cornerstone of lifestyle medicine, because obviously lifestyle medicine is sort of the home that we sit under, but it has different rooms in that home. And one of the key homes, the feature homes with an awesome view is exercise. And so we're going to talk about that. But before we do, we're going to play a little bit of a word association game. I love these psychology games that people play, like the story of the guy who goes to the psychologist because his wife says, you need to get help. You are car mad. And he goes, I'm not. And anyway, he eventually goes to the psychologist, and the psychologist says, well, I'm going to draw some pictures, and then I want you to tell me what the pictures remind you of. And so the psychologist gets a bit of picture and just draws a sort of a squiggly line, turns it around, and the guy looks at this picture and goes, oh, that's a Ferrari. I love Ferraris. Have you seen the latest Ferrari? And anyway, the psychologist is a bit, surprised by this. So he gets a bit of paper again. And he just puts a couple of dots on the page and then a couple of squiggles and turns around. The guy goes, oh, that's the latest model Lamborghini. I love Lamborghinis. And anyway, after about 3 of these efforts, the psychologist says, okay, well, look, I've concluded my determination. You actually have a car obsession. And the guy looks at him and goes, what? He says, me? You're saying I have a car obsession? He says, you're the one that keeps drawing the pictures. So anyway, I love these little psychological games. So we're going to play a word association game. And I want you to participate, and I can see you, so I will know if you're doing this or not. I need you to put your hand out like this with your thumb to the side. Okay? This is the first, the first 3 minutes I'm getting you moving. This is a little subtle thing. Okay, we start like this. I'm going to say a word. If the word gives you a warm fuzzy, then it's thumbs up, right? If it's like, sickening into the pit of your stomach, it's thumbs down, and then you can just leave it in the middle if you're a bit nonchalant about it. So here we go. First word. Chocolates. Be honest, folks. I know this is a lifestyle medicine-y thing, but hey, you know what? All right. Yeah, Bryce is doing all right. Okay, back to the center. Monday morning. Mel, you're meant to love what you do. Okay, I'm good to see Ruth. Loving it. Okay, back to the center. Exercise. Oh, you know what? I'm scrolling down now. I'm seeing a lot of thumbs up. You can put your arm down because your shoulder might be getting sore. You know what I can tell you is that for most people, when I say the word exercise, it's not a thumbs up. For most people, when I say the word exercise, in fact, I've presented, in many places all around the world, and if I have to extend that word association game and say, when I say the word exercise, what are the first 2 words that spring to your mind? There are 2 words that almost invariably come out, regardless of what country I'm in. The first one is, anyone guess what you think it might be? Just unmute yourself and call out. What do you reckon it is? No one's game?
Boring.
Boring. Was that about this presentation, Jenny? Boring comes up. It's not the top pick. Anyone else reckon? What's that?
Pain.
Pain. There you go. Who was that? Homer. It's exactly right. It's pain. Pain is the top one. Normally the second one is sweat. Right? And this intrigues me. Now, you know what we know, and psychologists have known this for a long time. I think it was Aristotle that sort of told us this a couple of thousand years ago, is that we humans are motivated by pleasure and pain, right? We do things, we draw closer to things that give us pleasure, and we move further away and resist things that cause us pain for the most part. So here's the thing, if most people equate exercise with pain, can you see that we have a bit of a disconnect here, don't we? And it's little wonder why so many people are going to struggle to want to engage with that. You know, I think one of the things that we need to start doing is using different terminology and start to think about and reframe what actually being, exercise, what that actually means, because it definitely doesn't need to be painful for it to have, untold benefits, as I'll highlight in some of the studies I'll show tonight. So one thing you'll find is throughout this presentation, I probably am going to use the word exercise very little. What I will talk about though is active. And it's interesting, when I talk about being active, most people are like, oh yeah, I can do that. It's more of a thumbs up as compared to eh. And so, and you'll notice that even the terminology amongst the exercise community is moving towards being active and maybe physically active. And so you'll find that trend coming through. So I'm actually going to start tonight by talking about the bad news. I don't know, let's just get over and done with. And then we're going to move on to the good news and the exciting stuff. So let's kick it off by talking about the global physical inactivity crisis. Homer, do you have a bird on your shoulder?
Yes, I do.
How's that? It even matches the colour of your jumper. Well, that's fantastic. Very cool. Sorry, just a little bit of a distraction there, but that's a good distraction. Okay, so the global physical inactivity crisis. Are we suffering an inactivity crisis? Yeah, all the data seems to suggest that we are. As you well know, one of the top ranking medical journals is called The Lancet. And this has had a great interest in following the trends in physical activity throughout really over the past 10 years or so. In fact, they've had a couple of series in 2012. They ran a series in 2014. They ran a whole edition dedicated to looking at physical inactivity and the dangers of it. And then there was another update in 2018. But this is what they're calling it. They're calling it, before the COVID pandemic, they were calling this inactivity crisis a pandemic as well, because it's so, it's widespread and it's affecting us all. And in this 2018 report, they actually did a study where they looked at what's happening in all of these different countries around the world. And what you can see by this trends is that pretty much this is endemic. So all around the world, for the most part, we're seeing reductions in people's physical activity levels. My little flicker's not working well, but what they end up by rating is that about roughly a third of adults are inactive, according to the standards, and I'll talk about what that is in just a moment. You can see it's more prevalent for females than males. And there is quite a great disparity between the different countries. There are some countries that are highly, highly inactive. The top ranking was actually Kuwait, which is interesting enough. And you can see the lowest level of inactivity is in Uganda. So what we tend to see is that in developing countries, that's where we have more movement, which is a positive thing. And in developed countries, we have a whole lot less movement. And so, I know in the lifestyle medicine community that there's a saying where they talk about when people start to live like they do in the West, they start to die like they do in the West as well. And it's because we start to see this shift in people's, it's not just their movement patterns, obviously, but it's their eating patterns and their stress levels and all the rest of it. So, this is a pretty serious problem. A third of adults globally are now inactive. And this little map here, if you want to check out the report, and for those who are doing this unit, all of these details are on Moodle, and you'll be able to check out the studies for yourself if you like. But certainly the picture down the bottom there are the women, and the picture up the top are the males. And you can see that the more red it is, the higher levels of inactivity. Can you guys hear really loud music in the background? I apologise for that. It's actually, my office is in the auditorium, and they've got a big, I didn't know that they were going to have this tonight, but there's some sort of special social feature going on. It sounds like Star Wars music playing at the moment, but I'll talk loud anyway. So, that we know that there is this global physical inactivity pandemic. I'll stay on track, but it'd be very interesting, and the epidemiologists are looking closely to see what the COVID pandemic is how that will influence these activity levels. And it will probably be, once again, there's going to be a disparity there. In certain parts of the world, like certainly during the lockdown period, I have never seen more families out walking and riding together, which is a fantastic thing. But then I did a presentation to a corporate group in India 3 weeks ago, and some of them hadn't left their apartment for the last 5 weeks. And so we're going to have, pockets where they're really hit hard, and then others, there may actually be benefits in terms of physical activity levels. Certainly if we look over the last century or so, there has been a massive decline in the average movement patterns of the average adult. And so this little graphic here, this is actually was a PhD of a student of Professor Gary Egger, who you'll get to hear, if you haven't heard from him, in the lifestyle medicine course here. He contributes to this. He's a great guy and sort of considered one of the fathers of lifestyle medicine in Australia. But this is one of their studies where they actually mapped from the best estimates how active the average adult had been over the past 100 years. And it's the green line. So it's that top sort of green line represents their daily energy expenditure. And what you can see is that about the 1900s, people were quite active. Then a world war comes along, and all of a sudden people start running around with guns and stuff. They actually get more active during sort of economic downturn, like the World War period. Then we have the Depression. Really interesting. Look, physical activity goes up during the Depression, because obviously people they don't have the mod cons. They can't afford petrol for their car, so they've got to walk, and they've got to, do their own farming. So, they more subsist. So, and what's really interesting, there's some good studies showing this, is that during periods like the Depression and periods of economic downturn, you actually see chronic disease drop off. And then when the economic boom starts again, all of a sudden chronic disease goes up. So there's the economic growth in a country almost mirrors the increase in chronic disease, things like heart disease and diabetes. Very interesting. So then we see, we had World War II, and then all of a sudden, it's time for the Brady Bunch and all those sort of, the 70s. Great times, and we're getting these little mod cons, and we're getting cars, and we're getting washing machines, and we've got fridges now, and we don't have to go and gather our water and light the fire, and and then all of a sudden what we see, particularly probably from about 1980, we started to see these massive reductions in people's activity levels. And then the home computers come on the scene, and the internet comes on the scene, and you can see that we have this, what they estimate to be, probably a 60 to 70% reductions in physical activity levels, which is like, the estimate, it's probably like walking about 15 kilometres less every day. So the average adult today, is like sort of walking the equivalent of about 15 kilometres less every day than those living just a few generations ago. It's interesting. This was a study, once again, in Lancet, and nearly a decade old now. But what there was a very large study looking at what are if we look at the burden of disease globally, what are the key contributors to this? And sorry about the busyness of this slide. I've just cherry picked a couple of images out of this. But what you can see, 1990, you can, and I'm actually looking at my big screen to read this, so I should be wearing glasses or something. But you can see can you guys see that on your screen? Okay. Yeah, I hope you can read it, but you can see that, some of the top contributors to what we call disability adjusted life years, or really the burden of disease, with things like, malnutrition, childhood underweight, pollutants, tobacco, smoking was sort of in 1990, the third biggest contributor to the burden of disease. High blood pressure, alcohol use comes in there. Have a look down that list. Physical inactivity doesn't even appear. Interesting, isn't it? And then by the time we get to 2010, and all of a sudden physical activity is halfway up the list. And what we now know, and I'll go through some of the evidence for this too, is some of those things higher on the list, like high blood pressure, number one, that's actually physical activity has a direct bearing on that. As it does on things like high body mass index, which is about number 5, and high fasting plasma glucose, so high blood sugar levels. Childhood underweight. So what we see is, over this 20-year period, we see all of a sudden physical activity or inactivity becoming more and more problematic and starting to feature. So what's going wrong? What's changing in this period of time? And probably there are 3 key contributors to it. Number one, the changing nature of our work. Right, so have we got any coal miners with us on the line tonight? Who here? And what about some tree fellas? Who's our tree fellas? Just raise your hand. And not with chainsaws, by the way, axes. Any axe tree fellas? No, didn't think so. So, what we know is that, once upon a time, this is what mining, coal mining looked like. My grandfather was a Welsh coal miner. And I remember him telling me stories about, he actually joined the army to get out of it. He said, I didn't care where I was, even on a front line. It was a lot better than being down a coal mine, dragging coal out. That's how you dug it out. That was the mine, and then they dragged it out by hand. This is what coal mining looks like nowadays. Right? So, and I've got good mates, and some of you would know many people who work, say, in the Hunter Valley here in coal mining operations. You can see the guy, the coal mining operator. Does he look like he's super active? Looks pretty sedentary to me, So really, it's about this much activity. And the actual miner is that thing with those chopper blades that goes around and cuts the face. And then do they have to sort of put it in a little barrow and drag it out using their legs? No, there's a big conveyor belt that does that. So even these historically very physically demanding occupations are more and more becoming automated. And so we have this massive changing nature of our work. And for those who, many of us, we're not even getting outside at all. We do this sort of stuff. And I don't know why I picked that picture, but I just sort of figured that guy doesn't look very active and he doesn't look very happy. So just to prove the point that, being active makes you happier. But many of us do this. We sit there like this for, 8-10 hours a day. And we're in these sort of, tight knit compartments. In fact, what we know is one of the worst things that we are doing is, and this is now considered an independent risk factor. Right? So yeah, being inactive, like not moving enough is one thing. But what we know is that even if you do move a fair bit, but then you just have extended periods of putting your feet up and putting your feet up like this, if you do that, then all of a sudden there are a whole lot of physiological consequences which set you up for poor health and make you more predisposed to chronic diseases. So there's now, and you would have heard about this, there's this whole idea of this sitting disease. We know that yes, we need to be active, but we also need to not move. There's too much bottom dwelling going on. Bottom dwelling, that's what I call it. And we know as I said, that's an independent risk factor. So the nature of our work, number one, has changed, and that's setting us up for not for success when it comes to being active. Secondly, then there's the changing nature of our transportation. So there was once upon a time, if you wanted to get from A to B, you used your legs, and they're actually really good at doing that, helping us to move, ambulate from one spot to the next. Nowadays, it looks more like this. And we know that this is even in developing countries. So there you go. There's a motorbike. I bet you never knew that there was such thing as a 1, 2, 3, 4, 5, 6, 7, 8, 9 person, or there might be 10. There might be a baby in a bucket on the other side as well. So this is how we get around nowadays. And so there's actually one thing that governments are trying to set up is the promotion of active transport. We really need to get back to the active transport. And so there are some countries who now have dedicated bike lanes. There are actually even some countries that have more space dedicated to bike lanes on a road than motor vehicles. Now that can be problematic in some places. I love this picture. Look at that. Hikers and bikers move to the side of the road when a vehicle approaches. I don't think so. So, obviously the infrastructure needs to be in place to be able to enable this, but active transport is certainly a key thing that is attracting a lot of interest at the moment. So the changing nature of our work, changing nature of our transport, and then the third thing is the changing nature of our recreation. So, this is what walking the dog used to look like. And this is what sort of playing after school used to look like. And I remember as a kid, I got my brother Jace. You'd be outside, on your BMX, and you'd be making jumps, and you couldn't even see anyone. I remember Mum would be like, "You boys, come on, get inside. You have to have a shower, tea," and you'd resist that until the last skerrick of light. Nowadays, it's not like that. You know, look, I've got 3 teenagers and, you know, they're healthy kids and they're active kids, but there is just this incessant default. You turn around and they've got a screen in front of them, you know, and you're just like, put the screen down. And we even do stuff like we'll just turn the internet off and you just wait and all of a sudden these people emerge again like, whoa, wait a sec, out of this sort of comatose state. So, you know, we know that the nature of recreation's changed. That's what it used to look like. This is more what it looks like now. That's walking the dog. And when people default, you know, particularly young people, just so much screen-based activity. So our workplaces are changing, our transportation's changing, our recreation's changing, and what that's resulted in this bad news story, which is this, you know, global pandemic of physical inactivity. But enough of the bad news. Who wants bad news all the time? Let's start to talk about some good news. And the good news is that what we now know is that not exercise, but sort of exercise, but physical activity is an incredibly powerful thing for the prevention, for the management, and for the treatment of chronic conditions. And when we talk about chronic conditions, just for those who are new to the game, there are 2 sorts of things that can go wrong for you. One is, you know, what we call an acute condition. So these are generally accidents, injuries, and infections. So, you know, the Black Plague came through or COVID comes through and you know, things happen pretty quick within a space of a few hours or maybe a couple of days, or if it's an injury within, you know, even just a few seconds that your health turns. Chronic conditions are these things that tend to take a lot more time to accumulate. And so we're talking, you know, about, you know, certain cancers and certainly heart disease and you know, diabetes and some of these sorts of concerns. And we know that those things, you know, it's not like, you know, you go to bed one night and all your arteries are completely, you know, clean and elastic and lovely. And then you wake up the next morning and like, they're 99% occluded. Now, it doesn't happen. These things, they come on over time. And so that's why we're talking about these chronic conditions and what we know. And so just to sort of spoil the punchline for those who are new to the lifestyle medicine space, is that those chronic conditions, they are essentially, for the most part, lifestyle related. And so, you know, this is where lifestyle medicine, the genius of lifestyle medicine is that it's really about treating the cause of chronic conditions, which is lifestyle. And exercise is or physical activity is a huge part of our lifestyle. So let's look at some of the evidence first for the prevention of these conditions and through being physically active. There's been a lot of work done. You know, the question is, well, how active should we actually be? And probably one of the good ways to assess that is to look at people's activity levels, you know, populations in the world or even within a country or within a community. Some people tend to be more active, some people tend to be less active. And so if you do sort of a comparison of that, you can actually see, oh, look, you know, amongst these really active people, look at the prevalence of disease for them. And particularly we talk about things like all-cause mortality, which is essentially, you know, all sort of death, you know, all causes that can contribute to that. I don't know why that flipped there, sorry. And what we see is that there's definitely this very strong trend when people are more active, physically active, their risk of dying from all causes is reduced. Whereas when people are not as active, their risk goes up. And so what you can actually see is if you look and sort of map and, you know, you sort of said, well, how active are people and where do you get the most, you know, how active do you need to be to get the greatest reduction in your, you know, chance of, you know, developing certain conditions and dying prematurely. You can get some hints then as well. You know what? It's around about, seems like this seems to be the optimal levels, or maybe not the optimal levels, but certainly you get really good benefits if you aim for that much, because that probably represents what the body's designed to do. And so there's been a lot of studies done in this space, and what the studies tend to consistently come up with is a little, you know, sort of a J-shaped curve that looks like this. And so what you can see in here is that as people are progressively getting more active, and you can see the sort of the timeline along the bottom there, and it's measured in different ways. Sometimes we just measure how you know, so many minutes of how many minutes people are active. Sometimes we talk about how many steps they might do, because walking is an excellent exercise, and that's a good step counting is sort of a good surrogate for how active we are. You notice on the bottom of this little axis here, they talk about METs, and you don't need to stress about that and worry about too much what it is, but MET is the metabolic equivalent. So if I just sort of am sitting completely at rest, how much energy do I burn? Well, if you sort of took that measure, where if I'm active, I increase that energy output. And if I do, a certain level of activity that causes me to burn energy at twice the rate, that would be 2 METs. And if I went up 3 times the rate of my resting level, it'd be 3 METs. And so sometimes they quantify it in that way. But all of that said, what we've sort of consistently seen is that somewhere between around about 150 minutes to 300 minutes of moderate intensity physical activity seems to be the zone where people are getting the bulk of the benefits. So if you're doing less than 150 minutes per week, that's when you can see sort of hazard ratios for mortality are quite high. And so if you get to 150 minutes, you've sort of got the bulk of the benefits if you're targeting that. Now, 150 minutes, what does that mean? Well, that means about 30 minutes, 5 days a week. And so this is where you've probably heard, and I'll refer to this again a little bit later, but that whole idea of, sort of aiming for 30 minutes of moderate intensity activity a day seems to be the go. That's where that recommendation comes from. Interesting thing, what is moderate intensity physical activity? If we were all together in the room, which would be a whole lot better than Zoom, but if we were, we could sort of banter and talk about what that might mean. But in a nutshell, moderate intensity physical activity is considered about a 3 to 4 out of 10 in effort. Now that's not that hard, really, is it? So when we talk about moderate intensity, we're not talking about clutching your chest, tongue hanging out in a lather of sweat. We're talking a 3 to 4 out of 10 in effort. That would be the kind of intensity that you could talk with someone. You could hold a conversation with them, but you couldn't sing. Perfect for COVID period, hey? So that's the kind of intensity we're talking. So it's not that hard. It's not I think this is a really important message. It doesn't need to be painful. So let's forget about that pain word. It's just 3 to 4 out of 10 in effort. I can walk, I can hold a conversation, but I'm breathing it. I've noticed that I'm breathing it more than I would, such that I couldn't actually sing and hold an extended note, which I can't anyway. So it works pretty well. What we do see though is that after about that you get extra benefits up to around about 300 minutes a week, which means that's about 60 minutes a day. And what we now know, and in fact the truth is even beyond that you do get more and more benefits, but they're diminished returns by that. So there's very much this dose-response relationship in terms of how active you are and your risk of dying prematurely from a whole range of different diseases. So yeah, that's that guideline. 150 minutes a week, 30 minutes roughly, sort of a day. That's the sort of the lower boundary. Upper boundary around about 300 minutes a week, which is 60 minutes a day, is even a lot better. In fact, what we do, and you'll find this in the physical activity guidelines, they say for children, they should be doing 60 minutes a day. Right? So growing bodies need more activity. So that's actually all the physical activity guidelines, while they recommend 30 minutes for adults, they say 60 minutes for kids. All that said, what we now know is that the more you can get closer to the 60 minutes a day, and I don't want to, it's funny, I would even have to be sort of having this caveat. I don't want to overwhelm anyone and think, oh, I was thinking about 30 minutes and now you just told me 60, forget it, it's game off. What we now know is that the closer you can get to that, the better. And you know what? The reason that the physical activity guidelines haven't started saying, hey, do this if you can, is because of for fear that it'll just get too overwhelming and they won't try it all. And so it's really quite interesting. They've stayed with their 30-minute recommendations, even though they know that this is where that people should be at. Our bodies need a lot of movement. That's the bottom line. So one way of measuring it is that, how many minutes a week are you doing? Another one, this actually just came out, Mel shared this paper with me. I hadn't seen it come out in JAMA, which is the Journal of the American Medical Association. This was just a couple of weeks ago. They looked at step count, right? And I actually really like steps. I've got this really fancy watch, right? This Garmin thing that's a GPS and does all these great things. And you know what? I'm just not very techno, and I don't use it for anything other than looking at my steps. So anyway, but I think steps are a great thing, and because it gives you a pretty good surrogate as to how much you're moving. And what you'll see, there's a little the goal has always sort of, what they try and encourage people to do is the 10,000 steps, and you would have heard about the 10,000 step challenges. And you can see the data seems to stack up with that quite nicely. You see when you have this, people are only doing like 2,000 steps a day, their risk of, premature death is very, very high. And then as it drops off a bit, even if they can add a bit more, come down to 6,000, 8,000, by the time you get to about 10, particularly 12,000, over 12,000, there's not a lot of extra benefits, it seems. And what was quite interesting about this study is that they found that exercise intensity didn't have a big impact either. So I don't know if you're familiar with Dan Buettner, who wrote the Blue Zones book, and he actually studies pockets in the world where people live for an extraordinary period of time. And one of the common things that he sees in all of these population groups of long-lived individuals is that he calls it they move naturally. Right, so they don't run marathons. So they don't actually go to the gym and lift weights and all the rest of it, although there's great benefits associated with doing that. But what they do is they just move lots. So they're always moving as part of their daily activities. So so the whole 10,000 step is still a great goal to go after, and it's a nice objective way. It's sometimes harder to go, oh, how many minutes of moderate intensity activity have I done this week? Trying to quantify that's harder. But to be able to look at a thing and saying, you've done X number of steps today, then it's a nice little simple measure. So if you don't have a step counter or a pedometer, worth thinking about getting one. So what we know is that physical activity, being active, definitely reduces your risk of all-cause mortality. It effectively adds years to your life. But what's really interesting is it also adds life to your years. And apart from the fact that we know that when people are more active, they're more energetic, they have less diseases, which means they're going to, not be suffering as much. There's this great interest now in this whole idea of what we call morbidity compression. And what this essentially means is that, if you have the average lifespan is around about 80, just over 80, 81, 82 in Australia at least. But you know what? In many developed countries like ours, the last decade, even 11 years, is quite dysfunctional, right? You have high levels of, what we call morbidity. Morbidity is like you're not dead, but you sort of wish you were, kind of, not that bad. I'm exaggerating, but it's you're not in a great state. You got a lot of, suffering, a lot of conditions, you're ill health. And what we know is that being physically active is the best way. So this is the best ticket, right, to actually reducing the amount of time at the end of your life that you have, suffering ill health and are compromised in your functionality and all of the rest of it, is to be physically active. So exercise is the ticket to that. And you know what, I often, I love to, talk with people, and we could have a discussion about this, but what would you rather? Would you rather, a long life or just a really long functional life? Do you want the last decade or even 15 years or 20 years of your life to be, really quite severely compromised? Or would you rather just be and this is what we see in highly active people, they'll often, they might, even if typically they live longer, but even if they don't, it's like they're going really well, and then a month out, boom, thing goes wrong, and then it's all downhill from there. So that whole idea of adding life to your years and years to your life, I think is a really big draw card for being physically active. So how does it do that? Well, what we now know, and the science behind this, and I've actually got this paper on Moodle for those in the class, but we know that physical activity or exercise is associated, or lack of it is associated with about 35 different conditions. But what we do know is that when people are active, then it actually can be instrumental in the management and even treatment of these conditions. And like I said, there's about 35 of them. I've got this, I'll actually put all these slides, or I'll send you, if anyone wants the link to this video, you can check this out again later. But this is a really cool little graphic that you can check out. And what you can do is just highlight over these dots. And as you do, it's an interactive design. You can actually see what part of the body exercise is good for, and the kind of some of the stats in terms of the impact that it can have. Stats like this, heart disease, a reduction of about 57%, a stroke 35%, it's a third of strokes, Alzheimer's. What's really interesting, and I think this is a really key message, is that actually they've even said that the 20th century was the century of cardiovascular disease. The 21st century will be the century of neurodegeneration. So we're talking here about, mental health conditions. We're talking particularly about dementias and Alzheimer's. And, what we know is that unlike cardiovascular disease, where we have some, although exercise is excellent for that, as I'll touch on in just a moment, and so is lifestyle, because it effectively, most of heart disease is preventable. About 80% of it's preventable through, sort of therapeutic lifestyle change. What we know is that when it comes to, but the problem with why lifestyle medicine, I believe, hasn't really hit its straps in terms of, even though it's so good for heart disease, it's the best thing for heart disease. The problem is that there are other options for heart disease. There are options like, certain pharmacology, so we've got statins and all the rest of it. And then there's surgeries, it's really interesting. I know I actually interviewed Corbel Esselstyn one time. He's a big name in lifestyle medicine, one of the early pioneers. And he said, I remember him saying, he goes, I have people, because what he does, he says to people, you need to go on a really low fat diet, completely plant-based, if you have heart disease, and I can help you reverse it. And he says, people say to me, serious? But I can't eat any of that stuff. And he goes, no, you're just going to have to, so he's really militant with him, because he said, you're on death's door. I can help you, but you need to completely revolutionize your diet, right? And do this and only eat this way. And he says, they'll say to me, that just seems really radical. Anyway, he says to him, and so are you telling me having your rib cage cut open down the center, someone pulling your, parting and then sewing on vessels that aren't meant to be there, that's not radical? Which is the more radical, eating a plant-based diet or... Anyway, the point is that what we know is that with heart disease, we have had other options available to us, and we still have those options available to us. And so people often opt for those kind of options as compared to, lifestyle medicine. When it comes to the brain, we don't have those options. And what we're discovering is that lifestyle medicine is very, very good. In fact, it's the only really effective things we do have for helping to manage neurodegeneration. And exercise is a cornerstone of that. So depression, anxiety, certain cancers, osteoporosis, type 2 diabetes, exercise is very, very, or inactivity is linked to all of those things. So here's the really good news. Okay, so yes, we definitely know that being active is associated with the prevention of a whole heap of diseases, about 35 of them in total. But here's where it gets exciting, and that is what we're discovering is that even for people who have a certain condition, what we know is that when they get active, it can actually it'll be very helpful for the management and sometimes even the treatment of these conditions. I was actually in the US, this is probably going back 10 years ago now, but I was in Dallas and Texas, and I remember there was this, I don't know if anyone ever remembers Dr. Kenneth Cooper. He wrote the book he was the guy in the 1970s who wrote a book called The Aerobics Revolution. And he was the first one that started to promote exercise and say, but aerobic, do stuff that makes you breathe and more air. Aerobic just means with oxygen. And so he was a runner and he got all these people moving. He just got pretty much a nation of people moving. He was sort of the father of this. And he set up this center called the Cooper Research Institute and Center. Anyway, it was about 10 years ago. I was in Dallas and I thought, hey, I had a day to kill. And I thought, I wonder if I could go and visit the centre, because I know they do a lot of research and a lot of publications come out of it. And so I called them up, and Americans are often really super friendly. And they said, the lady goes, yeah, come and I'll give you a tour. And so I went to this centre. Anyway, I said, I didn't know how to broach, because I thought that Dr. Cooper would have died ages ago, because he was, he wasn't young when he wrote these books and stuff in the 70s. He was a well-esteemed medical doctor back then. Anyway, I sort of thought, how do I ask politely, like, when did Dr. Cooper die? Anyway, I said, so Dr. Cooper. And she goes, oh, yes, he's expecting you. And I'm going, what? I was taken aback. I thought, I can't believe he's still alive, but I'm going to get to meet the guy. Anyway, went over, he was 83, and she took me over to his clinic. He was seeing a patient, so he still sees patients every day, this guy. And anyway, he popped out and he said, oh, hi, nice to meet you. Lovely guy. Anyway, and I said to him, because I enjoy running, and I said, oh, do you still run? And he goes, no. He said, I had to give up running about 6 months ago because I had a downhill skiing accident. But I should be up and running again in about 6 months' time, I reckon. My knee's coming good now. And I said, mate, this guy's just a legend. But he was the guy back in the 1950s. If you had a heart attack, what the best medical practice was, lie in bed for 6 months, bed rest, 6 months, don't ever exercise again. That was the medical wisdom of the time. And he comes along and goes, I don't think this makes sense. I don't think this adds up. And so he ends up by advocating for his patients and did a lot of research and to find that, and this is his quote, the best treatment and cure for heart disease is exercise. So now we know that if you go, for example, post-op, when people had, heart surgery or whatever, very quickly, within the matter of days, they'll have them up and moving. Right? Because we know that that perfusion, that blood flow, all that comes with being physically active is part of the best therapy that they can experience. And what we know is that, and people often point the finger, and there's a classic saying that, oh yeah, someone went into the hospital, and they're like, there are all these people there that have had heart attacks, and they go, oh, that dude there, yeah, he's a marathon runner. I'm like, okay, yeah, he runs as well, yeah, and so does he. And someone goes, well, you know what? Clearly, running's not good for your hearts. And then the doctor says, oh, wait a sec. He says, you know what? The reason that they're here is because they actually survived the heart attack. All the ones who hadn't been active and all the rest of it, they died when they had the heart attack. Because what we know is that when you're active, you get increased perfusion. You actually get increased vascularization, even in your heart muscle, such that if one certain vessel becomes blocked, you have other, what we call collateral circulation, other ways that your heart tissue can still get the oxygen and the nutrients that it needs. So we know that for cardiovascular disease, exercise is just one of the best things that you can do. I will confess that there is some evidence coming through to show that this ultra marathon type, hot, very long, and it's becoming a real trend nowadays where people are doing, 100-mile runs and, all this kind of stuff. There is actually good evidence that, as with most things, it's the dose that counts. So no exercise, really bad for you. A little bit of exercise or moderate exercise, really good for you. A bit more, yeah, even better for you. But if you go overboard with it, you actually start to see that the benefits drop off, and it can actually set up what we know as inflammatory processes within the body that can be not helpful. But the average person like you and I don't know if you're average, but I am, I exercise an hour a day. That's a great thing, so yeah, it's only you have to worry about that if you're doing, these people are day in, day out doing 4 and 5 and 6 hours every day. Exercise and type 2 diabetes. Once again, one of the best things we can get people doing is to move. I love this. This is comes from the National Physical Activity Guidelines for Qatar. I was actually doing a presentation over there, and I was looking at their guidelines, and I found this one, and I thought, how cool is this? This is their special considerations for people with diabetes. Right? So this is essentially listing, some of the the side effects, you know, and often we have these things called contraindications. So, you know, people shouldn't do this if they do this, or if they're going to do that, be aware of this. This is one of the side effects you can see in yellow there. If people, you know, if they're going to insist on being active, just make sure, and they've got diabetes, make sure that you're reducing their insulin levels. You know, how good is that for side effects? You know, so what we actually know is that being active makes your insulin your insulin responsiveness far better, right? So, you know, exercise, the benefits that come with it are huge. We know that when it comes to comparing exercise to drug therapy, it's actually, there are many studies showing that, you know, it's sort of equal effectiveness to help treat diabetes and cardiovascular disease. It seems to be more effective than stroke medications. It's equal effective as depression and drugs. In fact, you know, one of the things that I have to say, and I'm a big proponent of physical activity for mental health, and that is that exercise probably is one of the most potent and yet least utilised antidepressants we have available to us. You know, so motion creates emotion. How we move our body has a powerful effect on how we feel, and I could talk more to that, but yeah, it's very powerful for the treatment of cognitive decline. And once again, we actually don't have effective drugs for that. So I think this is one of the gold, you know, places where physical activity is going to start to really feature. And it's the same for exercise and cancer. There's a very strong link there, and there are many studies published in this space. In fact, there's a body called the Cancer Research. Oh, I forgot the name. It's a peak body which actually, Cancer Research. No, I might not. Oops, sorry. But what they do is independent researchers and look at all the data about. Oh, it's on the tip of my tongue. It's driving me nuts. But anyway, and what we know is that exercise is a key contributor to the prevention of cancer, and then is very helpful, particularly for some forms of cancer. One of them being prostate cancer. You know, we know that when men go on certain therapies for prostate cancer, they get, you know, their bone mass decreases because their hormonal profile changes, and physical activity is just foundational to that. My dad's actually been sort of living with prostate cancer for over 15 years now. And he will tell you one of the things that he's just really diligent about being active. He's 74 now, I think. And last week he did a 100-kilometre ride with one of his mates on their bike. And then I did about a 35 or 40-kilometre ride with him up the mountains last Friday. So he just says, I've got to keep doing it. And so he finds that a real key thing. It's really interesting, and I won't go into all the details. This gets a bit heady and a bit complicated, but you can check out the references there if you like. We know that it does a whole heap of things that we're only just learning about and discovering. You know, it reduces this inflammation. We actually know that that gene expression starts to change when people are more active in positive ways. And so that becomes really important as well. And this is the reason why, if you look at the guidelines, that in cancer treatment, physical activity and exercise are starting to feature more and more, and there are more and more reviews being written on this and promoting it. So here's the point, guys, and this is the punchline. This is where the name for this unit comes from, for those that are undertaking this unit. It's exercise is medicine. Right? Exercise is medicine. It's a powerful, powerful medicine. And we've known that, you know, this has actually been spoken about by, you know, Greek and Roman philosophers for, you know, a couple of thousand of years. It's a power. We need to move. Our bodies are designed to move. And there's actually a campaign. There's the American College of Lifestyle Medicine created a campaign called Exercise is Medicine. And that's pretty much rolled out around the world now, and has been adopted by Australia as well. So exercise is good. Physical activity is good. And so what's the takeaway is that, hey, we need to move more, right? It's pretty simple. Once again, it doesn't need to be painful. It doesn't necessarily need to be sweaty unless it's really hot outside. And then even then you can do it inside. But we just need to move a whole lot more. If you were in the room with me right now, you wouldn't get out of doing this. This is what Mel was referring. I get people at conferences to follow along with the wiggles. Just listen to this, right? You ready? One finger, one thumb, keep moving. One finger, one thumb, keep moving. One finger, one thumb, keep moving. We'll all So true. Thanks, Jeff. You know, that's a great little number. I get people to follow along on that. It's amazing how quickly that little song, if you follow the actions, make you feel good. So what we know is that we just need to get people moving more, and we need to be as creative as we can in helping to achieve that. Most countries have now adopted and created physical activity guidelines. I did a presentation in Fiji earlier in the year. They've got their own guidelines. You saw the Qatar guidelines. There's now the global recommendations for physical activity, and pretty much the recommendations are much the same across all the countries. Interesting, Australia's updated ones aren't just called the physical activity guidelines, they're called the physical activity and sedentary behaviour. So what they're saying is, yes, be active and don't sit around too much either. Right? They're separate things almost. We actually know that even if you exercise, right, say for 30 minutes a day, and then sit for the rest of the time, your risk of dying premature from all cause sort of different conditions, it goes back up again. It's only if you're doing about 60 minutes of moderate intensity activity each day that it doesn't really matter how much you sit around the rest of the time. So yes, that sit time, that sedentary behaviour is an independent risk factor. So most of the guidelines, this is what they recommend, that 150 minutes. Although, as I said to you, probably more is better. But if that's the realistic goal for many people, well, then that's what's promoted. And in addition to that, on a couple of days a week, they recommend that we do some strength-based activities, which doesn't mean you have to join the gym. It just means that you need to lift stuff and move your muscles in ways that they're designed to move. I will say this is quite interesting, is that we do know that when it comes to sort of your cardio, your heart health and diabetes and benefits and all that, 150 minutes of moderate intensity activity seems to be about the same. You can get the same benefit of that through half the time if you go at a higher intensity. But many people can't go at that higher intensity. So 75 minutes, they say, of a 5 to 6 out of 10 in effort is the equivalent of 150 minutes of a 3 to 4 out of 10 in effort. Why do they have the recommendation to do some lifting of stuff? Is because what we know is that this is a cross-sectional image of the thighs of a 40-year-old triathlete. You see a lot of muscle. The white stuff is adipose tissue or fat around there. This is a standard 74-year-old sedentary man. And this is what's happening here is a condition we call sarcopenia. And so you can see the muscle's very mottly now. Not a lot of muscle mass, a lot of fat. Even though they're the same cross-sectional, so look at these two people, they would have the same sort of, thickness of thigh, but you can see that the different in the composition. Down the bottom here, that's a 70-year-old triathlete. Now, whose legs would you rather have, this one or this one? Right? And it's all got to do with the fact that this person has been using their muscles. So and there's a whole host of benefits that come with that. Apart from obviously they're going to be stronger and more functional, but we know that increases their their basal metabolic rate. So they burn more energy even while they're sleeping. So it helps with weight control. There's a whole heap of benefits of doing these resistance type activities. And we know that you can do it into late in life. Even this Jack LaLanne, who even at the age of 93, he was still doing some resistance type activities and probably looked more muscular than me, which is a bit depressing. But anyway, we know that when you're I know I'm banging on about this, but many people know, oh yeah, walking. And walking is awesome. If that's all you can do, fantastic. But if you can, just do those sorts of activities. It might be just using your body weight to exercise your muscles and load them up a little bit. There is a whole heap of benefits that come from it. And because we now know that your muscles actually create chemicals that we call myokines that actually go all throughout your system. And they have positive benefits for every one of those things listed around the table there. And so these, in fact, in some ways, they say that your muscles are your largest internal pharmacy, right? Because of the chemicals, the beneficial chemicals they create. So we need to move more, right? Generally, people aren't moving enough. How do we help them to move from, that little guy not looking so great or mobile to look at that. How excited is she? And thanks, Mel, for that photo. Where were you when that was taken? I'm only joking. It's not Mel. I'm just teasing. But anyway, how do we do that? Well, that's an excellent question, and we don't have time to address that tonight. But for those people, actually for everyone, is an invite. The second module in this unit called Exercises Medicine, we actually look at behaviour change, and we're going to have a special guest presentation by Simon Matthews, who's the CEO of Well Coaches Australia and a psychologist. And so that will be the next instalment in about 5 weeks' time. So you'll get to hear from Simon then when we'll talk about how do we actually, there's a lot of benefits with being active. How do we enable people to actually do it? And that'll be the focus of our next discussion. But in that, until then, I want you to remember, guys, exercise is medicine. It's a powerful, powerful medicine. And hence, it is a cornerstone of lifestyle medicine. That's it. I'm going to stop recording right now.